So my name is Barry Harper, I'm an osteopath, and I set up Kinesis Clinic about 10 years ago. So I use the laser machine nearly on every patient that comes through our door. We find it's very versatile, but it's integral to part of our treatment plan. So with Agna, I've decided to use the laser. So initially I start with osteopathy, that's general kind of mobilization, articulation of her joint. And then I progress on to some soft tissue techniques or some instrument assisted soft tissue techniques. But then I'll come in with the laser as well. It's absolutely paramount that I get to use that for something like a shoulder injury, a rotator cuff injury, because it can help me reduce down the pain very quickly, which I can then kind of create a little bit more mobility in that shoulder and hopefully start off those restorative processes as quick as I can. As soon as I get the laser onto the tissue, they can feel the heat, so they feel something is actually happening around the tissue. And I think their feedback initially is they're quite surprised at how quickly they have their pain reduced. So for Agna's shoulder condition, I've selected the rollerball head, and the reason being is it will penetrate the tissue nice and deep because I can apply a little bit of pressure. It has a massage effect as well, so it's got the roller head, which gives me a little bit more mobility around that shoulder area. And then as I'm using the device, I'll go in a grid pattern, so I'm kind of trying to create these lines going up and down, forwards and backwards, and then sideways, making sure I'm hitting all the fibers of the tissue and the maximum kind of space within the amount of energy that I'm trying to supply into that tissue. Now, if you bring your elbow up like this, that's it. So with Agna, I get her to move her arm because the joint itself can move in 365 degrees. So it's really important that we get that mobility through the tissues, and also by incorporating the laser through that movement, we can get the energy into that source of tissue as quickly as possible in all the ranges that we hopefully can achieve eventually after once the shoulder is back moving properly. So finish the laser, did it feel okay?
Yeah, I felt some warmth and it feels a bit better than usual.
Good. Did you get a little bit more movement back into it, or did it feel like it's loosened up at all?
Yeah, it does feel like a bit better than before treatment, so.
Excellent. Okay, so I'll probably see you again next week and we'll do exactly the same kind of treatments and get moving a bit better again.
Yeah, okay. That's great.
Alright, thanks Agna.
Thank you.